Hello, my name is Amanda Ritchie and I'm a pediatric speech-language pathologist. I work here in Shreveport, Louisiana at a private clinical setting called Little Works in Progress. Today, I want to discuss a few therapy strategies that will help you when treating children with echolalia. A child who uses echolalia often repeats words or messages that they hear often throughout the day. For this reason, that's why it's called parroting. It's not right or wrong, it's just how your child is learning language, and it can often convey communicative intent. Okay, so if you hear your child echoing throughout the day, look at this as a window of opportunity to teach your child what he needs to know. So you may be asking yourself, why is my child echoing every single word that I say? Well, from my experience, I believe it stems from three things: a lack of understanding the question, a lack of understanding that an answer is expected, or even the inability to formulate an appropriate answer. I believe the key to treating echolalia is to model every word, phrase, or sentence depending on what level your child's at, but repeat or model those words, phrases, or sentences exactly the way you want them to say it. So stop asking your children so many "do you want" questions or "do you need" questions. If you know your child needs a cup of milk, or your child's reaching for a ball and it's out of their reach, provide them with an appropriate model. Because if you ask them, "do you want milk" or "do you want ball?" their very first response is going to be, "Do you want milk? Do you want ball?" Okay, and they're going to echo exactly what you say. So model an appropriate request. For an example, a way that you need to model an appropriate request would be, "I want milk." Okay, keep it short and simple for your child, in hopes that they're going to imitate what you're going to say. Parents don't like the idea of their child learning impolite or inappropriate words, but I'd much rather hear a word rather than having your child bite or hit or kick someone, all because we failed to teach an appropriate response. So teach them those words, "no" or "mine," okay? Another great way to model appropriate requests or labels or make funny comments is to get down on the floor and narrate play. Okay, so get down on the floor with your child, be fun and silly. If you act stupid, you're doing great, okay, because that's what your child loves, is for you to be silly and use funny voices. Another strategy to use is to offer them choices. If you have two objects in front of you, I have here with me a car and a ball. Hold the objects out in front of you and say their object name without a questioning tone of voice. Ball, car, and withhold the objects until they say their name. Another thing to remember when offering choices is to allow them to fill in the blank. For example, Bradley wants, and then pause and lean forward and offer to let them know that it's their turn to speak. Bradley wants, and then hold out for them, and then provide them with the word if they don't repeat you. Bradley wants ball. Good, Bradley wants ball. When your child makes an appropriate request, try not using words that are habitual, such as "okay" after every single time that they make a request, because your child may pick this up into their script and they may be locked into this particular pattern. Sometimes echolalia is a child's response when a system is overstimulated. Children often lapse into echolalia when they want to self-calm. So when they're tired, when they're bored, when they're hungry, when they're sick, or even when they're overwhelmed. Therefore, analyze the situation and see what kind of environmental support you can provide them with. So just remember, he's talking, he is trying, he is working on trying to communicate. It may be frustrating for you, but just remember, it's better than the alternative of your child being silent and not showing any evidence of learning language.